Okay, so you want to tell me a little bit about her?
Yeah, this is a 44-year-old woman. I haven't been treating her actively. She used to come to the clinic where I used to work. And she came to me recently because her husband dropped by to pick up some supplements, and he found out that we have this new thermography machine here. She had a hysterectomy a year ago because of unresolved, well, she had cervical cancer. And she had, for the last 6-7 years before having the hysterectomy, she was having abnormal paps. So she had done a number of things. She saw a number of practitioners. She has some resources available. She went to Mexico and she went to a clinic there. She had a lot of IV therapy. And even now she's doing 2 to 3 coffee enemas a day. So that's it. That's kind of what I know of what she's doing so far. We're going to have our first appointment when we do the follow-up on the thermography.
So she had cervical cancer and then had a hysterectomy.
That's right.
And so how was that found on exam? Or
because she had been having abnormal paps,
yeah.
They continued. Even though she was doing a number of treatments, the abnormal paps continued, and they thought the dysplasia just got too far. So why they did the full hysterectomy, I'm not sure.
Well, it can be her coordinated choice as well, and on her, her own opinion and age and factors. She just didn't want to have to worry and wanted to maximize her possible benefits.
That's right.
And so what we want to do is we want to see, well, what can we see if there was a distant causal element or influence that could have made her more vulnerable to, in a possible, we don't know, but we think in terms of HPV, we want to see if there are viral elements, because even though HPV is usually supposedly located in the pelvis, it can actually be everywhere, and all these infections are everywhere in the body, and they can even go to become squamous cell carcinoma of the GI tract and the lymph in the neck, or they can go to the colon. So let's see what we can see. Now, when we look for block spots, we see that there's a 30.8% blocked regulation in the neck. And you can see that all here in the neck lymph and the upper lymph. And so this is actually the most blocked region of the entire thermogram. Of course, we see some in the teeth, we see some in the head, but the teeth and the head are not as important as the rest of the body.
She does have Hashimoto's.
Okay, so this colder thyroid being below the baseline, but it's regulating in the right direction, shows that could be a possibility. But and then we see the block thymus point, which shows us there's an overall immune stress to the body, giving an increased vulnerability overall. In the chest area, in the upper abdomen, lower abdomen, and back, there's no mere blocked regulation. Neither is there in the cubital fossa. There's no blocked regulation in the breast. It's a good thing to look up here in the rigid column on the breast that's 0%. There's and then there's the teeth and the head, but we're not going to go there yet. We want to look at the span of the thermogram. That's going from this 30 degrees to 36.5, so there's a little bit of a spread in her overall integrity of her regulation system. And then we want to look for the side differences. There's none in the cubital fossa. There's none in the back. You see these are both very symmetrical. And we look in the chest, we see an asymmetry of the cardiac in the second cardiac, which we can think of more as the actual cardiac muscle. Has she had any kinds of cardiac symptoms?
No.
And then we see this asymmetry here of the ethmoids, which is the telltale sign when you have blocked lymph in the neck that there's a virus present.
Right.
There's no asymmetry in the mastoids, none in the CP points, not in the temporal points, and none in the frontal sinus. So what we do see is a little bit of paradox in the mastoid, which can be related to either the inner ear or the neck. Does she have a neck problem
No, she doesn't.
that you know of?
That I know of.
So that's the side differences. So what rings out so far in the whole thermogram is the blocked lymph and the viral sign, with possibly a little bit of thyroid, a little bit of heart, and there's some things going on in the intestines. There's a side difference in the breasts of 0.4, which is almost becoming significant. 0.5 becomes significant. And in the jaw, we don't see, we do see in the lower jaw 33.9 to 34.4. So that's a 0.5 degree difference in the lower jaw, and you can kind of see how this lower right is warmer than most of the points in the lower left. So we want to eliminate the virus because has she been tested? Has she had a viral panel of any kind?
You know, the form that she filled out, she put down Epstein-Barr.
Wow.
So
she was maybe had a blood test at some point?
Yeah.
So very often when you combine viruses or there's a complex of viruses present to create something like this, does she have any sinus problems?
No, that I know of.
So there's the moderate lymph block, there's the viral hint, so it shows you very clearly everything else looks kind of minimal except for the food intolerance. The food intolerance is indicated by the small intestine point being very, very cold, and you see how cold this point is, this intestine point, in relation to the rest. It's cold. It's the coldest point almost of the entire thermogram, so that's always a food intolerance. So the first place I start with patients is eliminating gluten and dairy.
Right.
And then she has this moderate dysbiosis, so you're going to want to always treat this. And then she has this pelvic toxicity, which can be related to the surgery,
Yeah.
or the adhesions that are post-surgical, or some continuing inflammation that she either had before or continues after the surgery. I like to use Sanum therapy for this in suppository form so you can get it into the pelvis.
Which remedy do you use, the Sanum remedy?
NIG.
Like,
And you could alternate Muc and NIG. And she's a person that could use thymus therapy and antivirals, however you want to do antivirals, either with lysine or olive leaf extract. Here you can see a little bit of the asymmetry here, and these 2 points are these two are the ethmoid points. It's hard to see on these, but you can see that we would like her to have normal regulation like this light blue, and just like in that cancer patient, she has a lot of toxicity, but you always have to use the criteria and the orientation as well as the context of the person that's coming in front of you. Don't forget that you're still, you're practicing a form of medicine, if it's natural or however you're looking at a person. You have to always remember you're looking at the individual and not just at this test and what this test reveals. And then you're applying the information that it's telling you to the patient, but you're also going to use other means to arrive at a true diagnosis. Mm-hmm. Now in the teeth, we want to see if any of these teeth could have been involved in either the viral aspect or in the pelvic vulnerability. Now, as you know, the front teeth are very connected through the meridian system to the pelvic organs. And you can see that there are all these interfaces with these bladder points. So if we count those up, 1, 2, 3, 4 points, 4 teeth are related to this meridian that's going right through the uterus. And you can see that also here. Here's a uterus point. Here's a uterus point. Here's a ovaruterus point. And here's an ovaruterus point. So these are the suspicious teeth. So we have tooth 7, 9, 10, and 23. 7, 9, 10, and 23, all towards the front of the mouth. Does she have anything like a root canal?
I would have to check.
So those are our suspicious teeth. if she had a root canal in anything in the front here, if she were in a German clinic, or she would have it removed immediately, and then she would have a non-metallic implant or a bridge in its place, because there's a possibility for an infection that's not going to exactly go away. She's going to still be in this place of vulnerability. And if anyone has a disease and then they remove the organ of focus by surgery, and then they tell you that everything is just fine, they're really not telling the truth, because what was it that made the person vulnerable in the first place? Our bodies are not just independently existing regions. They're all completely interconnecting and influential, and if the body wants to express itself, it will. So we're very suspicious of the teeth because of the high degree of correlation. The stress, if you wanted to predict whether she could develop breast cancer and categorize it, she's still in a safe category of only 5 out of 12 criteria. We want to clear up the lymph system, and if we do that, and this tells you to do that, this lymphatic load is moderate, so this is very important. And this distal related focal is either the tonsillar lymph in the neck or the teeth. If we look and if we look here for the dental, we do see that this molar for the breast could be involved, and we do have a side difference of a little bit in the breast, but it's 0.4, I believe, which is borderline. So she has like 4.5 out of 12 criteria.
Right. Her one comment when she came in was that her right breast, she was experiencing some discomfort, some pain.
Well, that's the warmer one, which is always the one to start with when you have a side difference, is whichever one is warmer. And it also may point to the teeth. So if, say, she had an abscess in a tooth that was on the right side, that's one of ours, that would be tooth number 7. Tooth 7 was connected to the uterus, but it's also on the same side as that breast. And do we have any breast teeth here? We do have a left breast tooth, number 21, which is also in this region that extends towards the bladder meridian. So I would wonder about tooth 21, even though that's left breast, because there's a crossing over of the control mechanisms to the breast. And on the right side, tooth number 30, I believe, is a breast tooth, but that's toxic, so I would check that out for amalgam. So I would be, if she's having some pain there, I would maybe see if she's had a mammogram, and I would I would start with treating the lymph system and then see if her pain goes away, and then do another thermogram in 4 to 6 weeks. In the general patterns identified, she is toxic, she is adrenal stress, she is the virus sign, she has the lymph system. So you got it cut out for your work you're going to do. Don't ever forget to treat the dysbiosis and take away the influences of possibly inflammatory foods. And
again, she's been eating a very clean diet. I don't know if she's had any gluten or dairy, but very little. She's been doing these coffee enemas, 3 a day, she told me. I'm just surprised to see the dysbiosis there.
Well, just if you clean out everything and clean it out again and clean it out again, you're going to just have the same dysbiosis that you had, except you won't have much stool that's sitting there creating re-intoxication, but you're still going to have the imbalance of the bacteria you had before. It's not going to do anything good for the microbial, biosystem that needs to be balanced. So I think and also, her biliary system is clear. There's regulation there. So I would see if I could influence her to stop the coffee enemas at least for 3 weeks, so that you could work on the priority of the virus and the lymph and get back the probiotic balance, and maybe help her with some fatty acids and some L-glutamine to get the gut healthy while you're treating the lymph, and then maybe she could think about doing them on a lesser basis. But that's not really coffee enema is not really focused on what her main problem is, and so she might, and people get addicted to those.
Right.
And really, I think here she has the combination of the virus, the lymph, and teeth. And I believe that she had this vulnerability in the pelvis because of something with the teeth.
Mm.
Because it's such a redundant message in the teeth. All of these bladder points, that the bladder meridian and the kidney meridian, the kidney goes right down the front, right on each side of the navel, and has everything to do with reproductive energy systems, which is cervix uterus. So because there's such a redundancy of this, I think that this is not going to just go away with removing the target organ, but something's going on with the teeth. So as we look here, we want to handle, if the food intolerance is dealt with, if she's on a clean diet, fine. Get her bacteria back and focus on the virus, the lymph, maybe give a little adrenal support, and then dentistry. So I would just add dentistry to this. So I would say this is this case is a cervical cancer, dental or lymph cause. That's, and that's the educated test. We're not 100% certainty, but you need to reframe it and show it to her that this is what you're finding, and it might be different than what she learned at, going down to Tijuana. But it's quite common that people going to Tijuana, especially with some of the therapies, they stopped doing, but they weren't getting good results at all.